A new study suggests COVID-19 can have a significant impact on heart and brain health years after an infection. Today, Jeremiah Jacobson looks at the new data and why researchers say everyone who's had COVID should be aware.
In 2020, before the vaccines were available, people who caught COVID-19 had twice the risk of a major cardiovascular problem like heart attack or stroke as those who didn't test positive, according to a new study.
What was also surprising is that the extent of that risk did not show any sign of diminishing or attenuation with time.
Dr. Stanley Hazen with Cleveland Clinic is co-senior study author. He says those risks in the medical record studied stayed for up to 3 years after the infection, and those who had to be hospitalized with severe illness from the virus were at even greater risk for heart problems.
That is, if similar to the risk of someone who had one heart attack and what their risk for having a second heart attack was.
Hazen says the risk also varied based on blood type. Researchers say people with certain non-O blood types, like A or B, are already at higher risk of cardiovascular diseases. But this study found those with O-type blood who were hospitalized for COVID didn't have quite as high of a risk of a heart attack or stroke. While the study didn't look at the effects of vaccination on cardiovascular risk, Hazen says since the severity of the COVID-19 infection is linked to long-term cardiac risk, getting protected from COVID-19 through vaccination is critical.
If you have had COVID, I suggest think about heart disease and getting your cholesterol checked and your blood pressure checked.
Hazen says researchers only studied older adults, but there's reason to believe that those results would be the same in younger people who have had a history of COVID. Well, the government is once again offering free at-home COVID tests. You can go to covidtest.gov to order up to 4 tests per household.